Okay, Margie Davenport, you've been on my list of people to talk to for so long, because you have so many good things to share in the area of exercise, both during pregnancy and postpartum, and so many other good things. But I was just saying before I hit record, it's amazing how the list of topics that I have get away from me. And so the list has been there, and I have covered a lot of your information on previous episodes. It's just never come straight from the horse's mouth before. So I'm so glad that we got to do this. And, before we get into the details, we're going to talk. Well, you specifically are at the University of Alberta. You're an exercise physiologist and a professor. And I know a lot of the work you've done so far has revolved around like both recreational and elite athletes and in the perinatal period. So this is a big topic. Like I think about a lot of the clients that come in to see me, and there's so many messages from, for example, social media around
Mhm.
exercise in pregnancy. And I would say some common themes are like, don't do this. This is okay. This is not okay. Be careful. This will do damage. You could make things worse. And I would say a theme is that people are losing a lot of trust in their body with a lot of these messages, and it's making people do less. And so I think it's so helpful for that to talk to people like yourself and other researchers around like what do we actually know, because a lot of this is not founded in research but rather rumor, right? It's a lot of rumors that get around that maybe we haven't actually done our due diligence with that research before. So before we get into the details, Margie, will you, for the listeners, introduce yourself and anything you want to share?
Mhm. Sure. So it was so lovely to meet you and be able to chat. So I'm a professor at the University of Alberta, Faculty of Kinesiology, Sport and Recreation. I've been doing research in the field of exercise before, during, and after pregnancy for close to 25 years now. So time goes by a little too fast. I'm also a former national team athlete, so I've had a really strong interest in certainly, in the general population, physical activity, but also physical activity in athletes during pregnancy and postpartum as well.
Yeah, and I actually like back in 2019, we're going to talk today about the postpartum period, but I just want to set the stage first and say like back in 2019, you and your team released guidelines, like the Canadian guidelines for exercise in pregnancy. And I would say overall, like when I reflect on kind of like how that's changed my practice, I still, at the end of the day, consider everyone an individual. Like they come in and they have questions around exercise or concerns around exercise. And I obviously want to know kind of like, what are you interested in? What do you like to do? What are your concerns? Like I always say, just blab a little bit about like what you've heard and what you're nervous about and what you want to do. And from there, I explain. I'm lucky to have the research that you've done to be able to explain. We actually know there's so many benefits to exercise in pregnancy, and there's not truth to all of the messages you're hearing. For example, it's okay to start something new. No, you don't have to worry about lying on your back at all times. We don't know, no exercise doesn't necessarily create miscarriage, like all of these things that you've heard. However, your worries, I'm still interested in. And it just helps me kind of feel a little bit more confident around like, okay, what do I need to actually be careful of? Or what information do I have to share with them? But what is this person in front of me still saying? So the focus of this episode is not around pregnancy, but I want you to just in kind of a summary, Margie, can you just share like what were those guidelines for? What need were you trying to meet? What did you learn from rolling that out? And then let's move to why you've moved on to the postpartum period.
Okay, I could take easily an hour
I
to answer
know.
that. However, so it's really interesting because before the 2019 guidelines came out, we had a lot of questions about whether or not exercise was safe, whether or not it was beneficial, whether or not there were certain people who could or should be doing what have you. And so, at that point in time, given those key questions, we actually took on it was just a huge, huge project, but it was necessary to be able to answer those key concerns So we did like a survey of 27,000 articles. We synthesized it into 12 systematic reviews and meta-analyses. And based on all available existing evidence at that particular point in time, we were able to very conclusively demonstrate the safety of exercise for the vast majority of individuals. The caveat being there are certain people who have medical conditions where, either exercise needs to be modified or tailored a little bit, or it might not be recommended altogether. But that's a very small portion of the population of people who become pregnant. But for the vast majority, there are huge health benefits, whether we're talking about, about 40% reduction in the odds of developing diabetes and high blood pressure in pregnancy, 67% improvement in the risk of having depression during pregnancy. And so that was a game changer that it allowed us to, within the scope of the current guidance, know that it's actually safe and beneficial to go and be active. If you weren't active before you were pregnant and you wanted to start while you were pregnant, we actually found that those benefits were even greater.
Mhm.
And so that information was really, really key. Certainly, there's a lot of information that we need to know. A lot of the concerns about pregnancy, are based on theory. Pregnancy is really quite unique unlike almost every other population where we come from a standpoint that physical activity is safe and beneficial. In pregnancy, what we're actually needing to do is demonstrate the safety before it's actually encouraged. And so we still have a lot of work to do, especially in the higher intensities, longer duration, more what I'll call extreme activities, although we're finding they're not that extreme anymore. That we don't have as much information, but it's certainly building, and that is simply because we built that foundation of information back in 2019.
Yeah. And I would say overall, like I can think of just on a daily basis when a pregnant patient comes in, that's something that I can, ask, what are you doing right now for activity? What do you normally do? Are you happy with the level of activity you have right
Mhm.
now? And it really is a good kind of conversation opener around like, okay, tell me why you're not, and let's talk about ways you can do more. And I think it really helps people. Oh my gosh, I didn't know I could do this, or I feel so much better.
Mhm.
And so again, like this leads us to now you and your team have taken on like, whoa, now we got to look at the postpartum period. And I think about some of the same worries. So if I think about the pregnant population is like, okay, I kind of want to, but because of all these messages, like I'm just not being
Mhm.
active and not near as much as I want to be. The same thing I find is happening in the postpartum period is because of I would say fear-based information, and a lot of like, oh, I hear so many things, so it just makes me do nothing.
Mhm.
I think that another trend, and so when people come in to see someone like myself, and maybe they have concerns around incontinence or prolapse or their core, their diastasis or pain, exercise and activity has to come up because we know how valuable that is for addressing all of those things. So
Mhm.
now, with that in mind, again, sometimes it's hard to provide guidance as a clinician when you sometimes get caught up in some of the rumors or the lack of evidence out there. So can you talk a little bit about everything you learned from the 2019 process? What made you decide to tackle this postpartum period and provide guidelines in the same way?
Mhm. So the plan was always to do recommendations for pregnancy and postpartum. Turned out that the pregnancy piece, we weren't expecting to have so much information available. We have this common idea that there's almost no information available. There's lots.
Mhm.
It just seems to be in this very small sort of range of, 3 times a week, 30 minutes a time, that sort of information. Um, and when we talk about postpartum, in many respects, it's kind of like this forgotten child. We go from pregnancy, you go through childbirth, and then suddenly you're just not pregnant again. And I don't think that when we talk about physical activity guidance, that we reflected on all of the unique considerations of the postpartum period, like the lack of sleep, the high stress, the change in identity, whether you had a C-section or a vaginal delivery, all of that is going to impact your interaction with being physically active. The other piece is that with postpartum, Our guidance before we released our new guidelines in March 31st, 2025 were from 2003. And they were embedded within the pregnancy guidelines at that time, and they were limited to two recommendations. One, engage in pelvic floor muscle training to reduce urinary incontinence, and that you can exercise while you're breastfeeding, and milk quality and quantity is not impacted. So that gives you virtually no information.
Mhm.
At the same time, as you said, there's rumors or sort of like longstanding traditions that you're not ready to be active until you're 6 weeks postpartum. On the flip side, there's this expectation that you should be active as soon as you're 6 weeks postpartum. Whereas everybody's journey is so unique and individualized, that we're not reflecting enough in physical activity guidelines to acknowledge the individualization of everybody's journey. And so that was one of the key things that we wanted to do with this particular guideline. And we actually spent about 6 months before we even started the process, just talking and consulting with postpartum women, find out what is important to them, what information they wanted and needed to know. Two of the key things that came up. One, they wanted to know about their mental health, depression specifically, and two, they wanted to know about their sleep.
Hmm. And what about their sleep? Because it is kind of interesting, like the 2025 Canadian guidelines for physical activity, sedentary behavior, and sleep throughout the first year postpartum. Like in some ways, it's like sleep. Why is that in there? So
Mhm.
can you tell me a little bit more? Like what about sleep were they curious about?
Mm-hmm. How to have better sleep, just to
Yeah,
get any sleep.
interesting. Hmm.
Right? So sleep is, underestimated until you don't have it. The importance of it, how important it is for your overall health and well-being. As somebody who went through two kids who refused to sleep, I swear, for like 5 years each, it creates havoc with your mental health, with your ability to recover, the just ability to think and engage in life. And that's a really common experience. But we also have this narrative that, you have to suffer through the poor sleep. There's absolutely nothing you can do about it unless go and you try crying it out. Well, I tried crying it out. I got to the point where I just had to do something about my sleep. And I was sitting on the porch, bawling my eyes out the same time that my kid was bawling her eyes out. And it wasn't something that worked. And so trying to find other options to be able to help support both moms and babies sleep is important. And there's no question, postpartum, you are going to have altered sleep. It's going to be shorter. It's probably going to be more fragmented, but that doesn't mean that we can't make small steps to improve it. And even those little small steps, whether it's I was up in Whitehorse, and a midwife was talking about she encourages all of her new moms to get this like little light egg that you tap on it, and it's just like this faint glow that doesn't fully wake you or baby up, rather than turning on all the lights in the room when you're trying to stumble through in the middle of the night. But just like those tiny steps that you know, seem like they should be intuitive. And, I
Hmm.
think there's a lot of expectations on moms that we know exactly how to care for
Hmm.
babies, or, we go to books and we read, or we go to the internet, but it's not always obvious, especially when you're sleep deprived. So having some guidance around how to improve sleep, even to a small extent, was really important to the women that we spoke to.
Hmm. And I think you've touched on this, but I think if I think of a lot of the circulating guidance right now, it is rest, like just kind of in quotes, like rest and then resume at 6 weeks.
Mhm.
Um, I see again a lot of a fear and a lot of people using the word permission. When I
Mhm.
say like what brings you in today, I just want some permission to exercise. I'm like, interesting that you've never met me and you're looking for you know what I mean? Like
Mhm.
I know that there's a lot of um emphasis on that. I also think I actually used to work in acute care for the first 7 years of my career. And I always say, like, what a funny message to start at 6 weeks. Like, we saw everyone post op day one. Like, open
Yep.
heart surgery, brain surgery, hip surgery, knee surgery. And half the time as a physio, I was intimidated to see those people because of how fresh they were, if you will. But I took out of
Hmm.
that the importance of early education, guidance, and just start the ball rolling. And I always say, I would never have shown up in those rooms to see the person be like, okay, let's go do some jumping jacks, let's do some sprints. Like or let's start with some heavy core. Like I would never have started there, but there's some sort of misinterpretation that that's
Hmm.
what exercise guidance is postpartum, and that if you start early, it's
Hmm.
too much. And so I'm just curious, given a lot of that, can you just talk a little bit about like what did when you go into first, let's say a lot of people aren't, well versed in what research is actually supposed to do. So can you kind of go big picture for a second and say, like, with a lot of that circulating information, as a team of researchers, what kind of gaps are you hoping to fill, or what do you picture that this will do? That's a big question.
Yeah.
No, Margie.
That's a big question.
Like, like as a researcher, like, how are you looking to kind of tackle this?
Hmm. So, I mean, that's a tough one, and it's a very, very big one to sort of think about. So, with the guidelines, as I said, we went out and we consulted with women to find out what information they wanted to, have in this guideline. But we can't make the information up. What we
Mhm.
have to do is actually go into the literature, see what research has been done that will potentially answer those questions. Sometimes the information is really robust. So, engaging in postpartum physical activity is associated with a 45% reduction in the odds of developing depression. That data was what we call high quality and strong.
Mhm.
Other information, such as this idea of early mobilization, we have to be really careful about the words that we use. It's not exercise. It's, not even light intensity physical activity necessarily. It's movement early after childbirth, whether it's a vaginal or cesarean delivery. That early movement and mobilization is really important. And you're right, it's not jumping jacks. It's literally as simple as getting out of bed to comfortably go to the bathroom without being afraid that you're going to burst open your stitches. And that's a really hard message to sort of translate and get out there. But you're absolutely right. Every other major surgery, my husband had major spinal cord surgery. He was up the second that the
Mhm.
drugs wore off, and they made him walk laps until he was allowed to be released. And if he wasn't able to walk enough, then he was kept in. And so it's the complete opposite when we're talking about cesarean delivery. 15 years ago, I was doing my PhD in postpartum exercise. I've been doing this for a long time. When I had my second daughter, I had a C-section. I was told not to get out of bed, and I didn't for
Mhm.
3 days,
Mhm.
right? And so there's this fear that, many of us will experience without having that evidence-based guidance to be able to tell you whether or not it's safe. And so we typically will take a very conservative recommendation if we don't know in pregnancy and postpartum that we don't take in any other population. And so part of the reason for the guideline, yes, to try and answer those big questions,
Mhm.
is it safe? Is it beneficial? But also to identify where the gaps actually are. So I was completely shocked that we had virtually no information. There was like literally a handful of studies available looking specifically at physical activity after a cesarean section. Okay, the rest is combined. And so we can't provide separate guidance in terms of, what should you do after a C-section? What should you do after a vaginal delivery? That information doesn't exist. We highlighted it as something that we desperately need this
Mhm.
information because it's one of the key questions that we are always
Mhm.
asked.
Mhm. Mhm. Absolutely. So I know you've mentioned that, in the study that you did, and you found that physical activity following childbirth decreases depression, it helps with mental health. Also to like urinary incontinence. That's a big one when people come in
Huge.
pregnancy saying that, and I ask, what are your goals? I don't want to be like my mom. My mom pees her pants. Like that's a really big goal that they have. Or what are some
Yep,
of the things that I need to do to not pee my pants like my mom? But that there was a big, like, I'm just looking at some of the numbers here, like 37% reduction. That's a big
exactly.
number.
It's huge.
Yeah.
Especially when it's something that is so prevalent in the postpartum period. And, if I think about, my generation, my mom, my grandma, they lived with urinary, well, I don't know this for a fact, I haven't
Yes.
asked, but, m most women of that generation lived with urinary incontinence for the rest of their lives. That is a huge barrier to being physically active. There's now data that is starting to link the experience of urinary incontinence to future development of cardiovascular disease. Like, this is not something that you just live with, especially when we know that there are effective ways to actually treat it and, potentially reverse it as well.
Hmm. Also to like a reduction in type 2 diabetes, but also just some other like, yeah, anxiety, like lumbopelvic pain, so kind of back and pelvic pain. That's a huge one that new moms come into physio for. Everybody's concerned about weight. What do I need to do to lose weight? So obviously, activity. But I do like I do feel like it's something. Activity is almost kind of like when people say like, have you done your, or do you think of posture? Oh yeah, yada yada yada, posture, yada yada yada, I need to get activity. But I don't think sometimes people realize how many systems they're targeting with just being
Mhm.
active. Actually, let's be a little bit more specific. Can you talk a little bit more about what the recommendations said about how much
Mhm.
activity?
Yeah, so it's interesting, and I get asked this one quite a lot because our recommendation is actually lower than what we recommend for pregnancy and what we recommend for general adult populations. So the recommendation is 120 minutes of moderate to vigorous intensity physical activity spread over 4 or more days of the week. So one of the most important things is you don't jump into it on day one. You need to gradually build. And so there's a gradual individualized increase in physical activity over time that's based on the symptoms that you're experiencing, as well as, how you're feeling and recovering. So again, very flexible, very individualized to your postpartum journey, but building up to that 120 minutes. So the reason we have 120 is because before we actually looked at the data as a panel, we decided on what we considered to be a clinically meaningful benefit, and we set a specific threshold. And then using, I'm just going to call it advanced stats, we were able to identify what volume of activity was needed to meet that particular recommendation. And so that was 120 minutes. We did the exact same thing in pregnancy. And then we hit 150 minutes, which just about killed me because I spent 3 years to get the same thing I could have pulled out of my hat and not done all of that work. But I think that's a really important message. There's nothing holding you back from doing that 150 minutes, but you actually need less postpartum based on the available evidence we have today to get those clinically meaningful thresholds. The other important piece that is often missed is that, if you don't hit the 120 minutes, you're still going to get substantial benefits
Mhm.
at activity levels well below that. So, for example, when we talk about depression, to get that clinically meaningful benefit to depression and depressive symptoms, we're talking 80 minutes of moderate intensity, so brisk walking every single day, or sorry, every week. So that's the equivalent of like 10, 12 minutes per day.
And you're saying too then, Margie, right, that you don't have to wait 6 weeks to start this.
Hmm.
Yes.
So there is nothing magical about the 6 week mark.
Hmm.
It's just been passed down for generations. Certainly, there's some appropriate healing timelines that
Hmm.
go with it. But I think it's important that we focus on more than just our physiology and healing timeline, that we reflect on the importance of, supporting our mental health, our overall well-being.
Hmm.
We also need to reflect on the fact that healing can actually be enhanced
Mhm.
by engaging in movement and light activity earlier on as well. And that's what some of those really early studies or studies that we're looking at, that early mobilization after a C-section actually found is that getting up out of bed, walking basically 4,000 steps per day, which is a very low number of steps per day, actually enhanced overall recovery and healing time.
And I think it's important to note here because I see in the guidelines you use the term individualized approach a lot, and I think about
Mhm.
some people are very intuitive. Maybe they've had previous injuries before, and you can see that they've paralleled that, and they just very intuitively have progressed slowly, and no big symptoms showing up, and they I would say feel very confident in that. Whereas other people, I think it's important for them to note, like, it's okay if you don't feel like you know how to progress, because this gradual progression is very important. Kind of like in my example of seeing people in the hospital, if let's say it's a joint replacement, a total knee or a hip or something like that. Of course, I want them
Mhm.
to get back to doing their most meaningful sports, but we're not starting that day one, and it's going to kind of progress slowly. I'm just, as a hospital-based physio, starting the first steps, and then there's going to be a build. And everybody gets that. I don't think anyone would come out of a joint replacement expecting to run first. Like that, and I think that intuitively people get that with their postpartum recovery sometimes, that they need to gradually add, but it's okay if you feel like you need guidance. And that's where
Mhm.
different providers are there to help. But I do
Mhm.
find there's a lot of people that when they come in, they're like, I'm exactly 6 weeks today. I'm so excited for my guidance. And this is where I would say I hope that's a takeaway for people, is that as
Mhm.
soon as you're ready for guidance is the right time, because you don't have to wait to start being active, right?
Yes,
Yeah.
absolutely. And I totally love that and completely agree. I think you know, when we talk about healing timelines versus, athletic identity and your mental health, like it always has to be that risk benefit being weighed. You certainly don't want to do too much too soon. You also don't want to hold yourself back because that can have detrimental effects as well. And I think that most people feel or kind of know when they're ready to start in the postpartum period, which is part of, well, it's a lot of the reason why we developed the Get Active questionnaire for postpartum. It's designed to empower women to feel comfortable, to be able to return that, initial phases. And you're also right that, there isn't a lot of guidance on the how to within the guideline. That is not what a guideline is designed to do because that really does come down to less based on research evidence because that data has never been put together yet. There are going to be separate knowledge translation pieces that will give examples of what your return to activity could look like. But that doesn't mean that it has to be exactly prescriptive, that you must, do X, Y, Z before you get to the next piece, because everybody's going to come about it in a very different way.
I want to ask you a little bit because you just touched on, like, I think I brought up that a lot of people are waiting for permission or waiting for
Mm,
clearance is what I'm waiting for clearance from my doctor, waiting for clearance from my midwife. Obviously, there's reasons why some people shouldn't be active, but something that you've added into the guidelines is what you just mentioned, the Get Active questionnaire. So, can you talk a little
mhm,
bit about this? Because this is something people can self-screen, right? So that they have
mhm,
an idea, like, am I someone that can start this process on my own, or should I check with my provider? Can you just go into a bit more
mhm.
detail on what that is?
Yeah, absolutely. So it's a new tool. So if you're familiar with pre-screening tools, there's in Canada, and it's been endorsed by almost major organizations around the world as well. We have the Get Active questionnaire for the general population. After the release of the 2019 guideline, we developed the Get Active questionnaire for pregnancy, which has been translated into 13 different languages and is considered the gold standard for pregnancy. And as a follow-up, we did the Get Active questionnaire for postpartum. So it's grounded in evidence. It's basically a self-screening tool where if you answer yes to any question, you're directed to go speak to a healthcare provider because you potentially, it doesn't mean that you do, but you potentially have a medical reason why physical activity may need to be adapted or restricted. But if you answer no to all the questions, then the goal is to empower you to feel comfortable, reduce fear, reduce anxiety about beginning physical activity.
And one of the things that I think a lot of people, if they were to describe a big reason why they've maybe not been active, I mean, there's so many barriers, like you mentioned. I
Mm,
mean, lack of sleep. I'm just trying to figure out how to be a parent. Um, I'm trying to figure out how to feed. Yeah, so many issues or barriers, let's say, to activity. But I do think another one is like fear of harm, right? Or
hmm
fear that I'm gonna hurt myself and take a step back. Can you talk a little bit about what your research found around that? Like, what did you find in that department?
hmm Yeah, great question. And so, also good cue. The second part of the Get Active questionnaire postpartum is that we also identified barriers to postpartum physical activity. So they're not actually reasons to avoid physical activity, but they are reasons why people do avoid physical activity postpartum. Oftentimes they require screening and treatment, but the reasons they're not contraindications or reasons why you shouldn't be active is because our data demonstrates that physical activity can help to improve these symptoms. So again, pelvic floor, urinary incontinence, mental health, fear of movement is the one that you're sort of touching on a bit right now. We don't have a lot of evidence that about fear of movement, but we know it's a huge barrier, this fear that you're going to cause harm. So talking about it with your client or your patient to have a better idea of what kind of harm they're concerned about early after cesarean delivery, we often hear that women are really scared that they're going to burst open their stitches. And I think that's mostly an unfounded fear. You'd have to do something pretty serious, but going for a gentle walk, that's not going to do it. Other women will be fearful of going out for, the early jogs because they're going to leak urine. But helping to understand that, this is something that can actually be treated and improved, and that physical activity in and of itself is actually beneficial for improving pelvic floor dysfunction as well, is also important.
Hmm. And again, I hear in so many of the things you're saying is that at the end of the day, I hope listeners can take out of this that your research is finding that there's so many benefits
hmm
to physical activity, like progressive physical activity early on, not needing to wait 6 weeks, and that the there's no um like adverse events, like
hmm
there's different considerations for different people, and that would need to be discussed with your individual provider. But as a whole,
hmm
it's kind of like saying nobody should eat broccoli. Like, do you know what I mean? Like, if you can't say that, same with that, you can't say nobody should exercise after, or exercise is dangerous.
hmm
However, I think there's also so many nuances that come into this, that your fear
mm
is your fear for a reason, or I acknowledge that you're nervous because of this. But I think that on an individual basis, that's why people should reach out for help. If you feel there is a
mm.
barrier to exercise, then address that, because the benefits like outweigh the risks, essentially.
Absolutely.
Yeah. And
Yeah.
so if you feel there's a barrier, it's okay to get guidance.
Mhm.
Yeah.
Yeah, no, I absolutely agree. Our data very clearly demonstrates extensive benefits to physical and mental health. And we went looking for the harms and we didn't identify them. There are a couple of caveats in there. You have to screen for those contraindications. That's really essential. It's also really essential that you ensure that you're, properly hydrated and fueled as well. It's really easy to forget to eat when you're postpartum. Sleep deprived, you're just going to grab whatever you can, and sometimes it's actually just not enough. But overall, we didn't identify any adverse effects of being physically active postpartum with those few caveats.
And I think too, this kind of highlights. I think people come out. I always describe like on two different ends of the spectrum. On one end of the spectrum is kind of like, whoa, I'm just kind of like waiting for everything to get better. Like I don't want to
Mhm.
exercise in case anything gets worse. So I'm just kind of waiting.
Mhm.
And on the other end of the spectrum are the people that are like, I'm 6 weeks and I'm doing like a triathlon and I'm doing,
Mhm.
because I'm like, well, I got clearance. Like no one said I couldn't do a triathlon, but they're starting with a triathlon, right? Like, and I think that this is where I always say to people, like, a triathlon, like, the goal of a triathlon is not bad, it's just hard. And so to start with that, it's like a great goal, but it's again nice to be able to lean on a recommendation like progressive exercise, right?
Mhm. Mhm.
Um, I'm just trying to think, Margie, as I kind of collect my thoughts here, any other questions like that I haven't asked that you think you really want to get across from the guidelines?
Mhm. Yeah, I mean, we've said it multiple times, and we say it many times within the guidance about individualization. And that comes in so many different forms. Whether you're talking about the timing, some people are really, really ready to go early on. There's literature data that's been published where, the athletes have been running 68 kilometers per week in the first month postpartum. Like that is one extreme. And then you have other people who are, nowhere near ready to begin physical activity at 6 weeks, let alone 6 months, or even, closer to that year mark. Both are fine. Both are the individual journey that you're actually going on. We know the benefits of physical activity for both mental and physical health, but you also have to acknowledge your own journey through that process at the same time. And so whether it's giving yourself grace, but just understanding your journey is your own journey, and you can't sort of look at one person versus the other and compare yourself at that point in time.
We know that it takes so many years for some of these findings to make it into kind of everyday practice. So,
Hmm.
besides things like this, like things like podcasts or different speaking engagements where you can talk about this, like I think about some of the information that these patients are getting might be from their fertility clinic, like in
Hmm.
pregnancy, like don't exercise, or from their, I had one client recently who said, and she had very routine C-section, but was told like bed rest.
Yes.
And so how do we, and I thought, oh gosh, how do I go against that, your OBGYN's guidance? But like it's not like the next person coming in that had a routine C-section is not going to be told that. So and this lady's mental health was suffering. So I'm like,
Yeah.
oh. So what are some things that now like how do you as a researcher get this into some of those important hands? Because I think, obviously women look to their providers for this guidance.
Hmm. So when we set out to do this guideline, I already mentioned we consulted with a lot of postpartum women to find out what information they wanted, but I didn't talk about who the we was. So certainly there's myself and a couple other people who are researchers, but we also had representatives from major organizations, so Canadian Physiotherapy Association, Canadian Association of Midwives, College of Family Physicians of Canada, Society of Obstetricians and Gynecologists of Canada, and then CASM in the named organization, the Canadian Society for Exercise Physiology. So those are major representatives of people who are directly speaking to women in the postpartum period about returning or beginning physical activity. And so that was one really important piece is that, we have the people that can talk about what their daily interactions actually are like, what is feasible, what can be done. But we also had a really important person on the panel who specializes in what we call knowledge translation. So it's getting the information in the guidelines into the hands of the people that are going to use it, whether it's postpartum women and people or if it's their healthcare providers and qualified exercise professionals. And so while the guideline itself, it took us like basically 3 years to develop it. We're actually moving into the next phase, which is in many ways a harder uphill battle to actually get this information out into the hands of the people who are actually going to use it. But that's where half the fun is. So whether it's doing podcasts, whether it's, writing articles that are going to go into journals that family physicians and midwives are going to see, whether it's developing infographics that are going to be mailed out to all, women's health physiotherapists and healthcare providers in Canada, like it's a long slog, but it's also probably one of the most important pieces that we're going to do. We don't just stop by the publication of the guideline. There's a lot of work that gets done, and it's an absolute grind, but it's worth every bit of it.
Also, as I listen to you talk, I'm like, she must have a passion for this, for the amount of work you have to dedicate to it. I hope that you see the fruits of your labor. Yeah, I hope that that's something. Do you find that with actually, that's kind of a off the cuff question, like as social media and all that can have its downsides, but I'm sure that this is
Mhm.
really helping people like yourself, like because it is kind of it's knowledge translation. Would you say that
Mhm.
as time goes on, you're noticing that like information gets out a little bit easier?
Um, I
Hard to
think
say.
so. What I get concerned about is that I'm talking into an echo chamber.
Yeah.
If we talk about things like social media, I have an Instagram account. It's great. I have 10,000 followers. Wonderful. We have, what, 40 million people in Canada. Like the message isn't getting out, and the people that follow are typically people who are already interested in the area. So trying to figure out how we can get the guidelines into the hands of people who are not on social media or don't care about physical activity or whatever else, that is where the struggle really comes from. But you're also right with social media. When I post a study, like we had a study on heavy weightlifting and pregnancy where we were monitoring fetal health. And it was the first one to actually lift a reasonably heavy load during pregnancy. And the sense of relief from the people who were responding to the post is exceptionally gratifying because it sort of validates that we have answered a question that people have had and have been waiting for. Social media has also been really helpful to actually drive some of the questions that we have because I'll get questions into my inbox or direct message or whatever you call it on social media. I'm not a good person on it. But those are the questions that sort of like drive our next research questions.
Hmm.
We try and, work with people who are pregnant or postpartum or who is an athlete or has a complicated pregnancy to give us an idea of what is important to them, what is the important next question to be able to answer. Because, at the end of the day, I've got like less than 20 years left in my career to answer these questions. The torch is being passed on to other people already, but we only have so much capacity to answer these questions. There's incredibly limited funding. The guideline itself was an unfunded project. This is why I look tired. There's and so if we don't have the support to do it, it takes 3 years to put this guidance together. It takes like a huge mental and physical toll on the people who are actually doing it as well, because this is not an easy process, but is absolutely worth it when we put out this guidance. And there's excitement, and people are telling you, I finally have some information to validate what I've been doing in my clinical practice for the last 10 years. Or I just had no idea what to do with my first time postpartum. It was horrible. I almost swore there, sorry. Um, and then, but they have a better sense of what to do moving into their second. So yeah, pros and cons, but definitely validating.
Well, it's appreciated, Margie. And I know sometimes some of the hardest part can be recruiting people to be in your study. So if is there anything you're working on now that you want to share?
Magical question.
Yeah.
Yeah, recruitment is always really, really tough for sure. We have lots of studies. I have them all on my Instagram page
Okay.
for sure. One of the big ones that's actually come out of the work that we've been doing with athletes is that nobody has any idea what to do in terms of physical activity around the time of egg retrieval or in vitro fertilization. So fertility treatments becoming incredibly common,
Mhm.
and most people are told to either stop activity, or we're hearing from certain athletes that they're just told not to restrict any activity at all. So we don't have any evidence
Mm.
base to support that. And so we have a new study specific to women who have undergone either egg retrieval and or IVF to get a better sense of, what's being recommended, but what direction we need to move in next to be able to answer those questions about trying to conceive and preconception.
Well, obviously, I'll make sure to share like your Instagram page in the show notes so that if anyone wants to check out, other ways that they can help you out. I'm mindful
Appreciate
that you need to go to school pickup here pretty quick.
it.
Um, uh, any other parting messages, Margie, that you feel like we've left out?
Um, No, I think we covered all of the big things. I think flexibility, individualization, and reflecting that everybody's journey is going to be quite different, that these guidance is here when you're ready for it, but only you really know when you are ready for this guideline.
Totally. And just to have that, I think what I take away is like how much faith and trust we can have in our body, that
Mm.
it's not as flimsy, if you will, as sometimes we've thought. But
You're not fragile.
you're not fragile. We don't need to bubble wrap you, but we just
Mm.
need to acknowledge your fears or the messages you've heard. And I think
Yeah.
that's a big part of I see my job with postpartum clients is like, tell me what you're nervous about. Now let me help you understand what's going on and how you're going to tackle exercise in your body in a way that makes you feel confident because I can
Mhm.
hear that you want to do it. It's part of your livelihood, it's part of your identity, it's part of your mental health, and so it's important. Yeah.
Absolutely.
Well, I appreciate you so much. I appreciate your time, and I'm sure we'll connect again at some point.
Sounds great. Thanks.